stick out to you?
You know, I think a couple of things that stick out in my mind are the Klockner walks, the enthusiasm, and the build-up to the walk is certainly a wonderful memory. All of the various groups that manned or personed, I guess, the phone banks is very memorable. The enthusiasm, and they brought special shirts that they would wear for the telethon. That's all memorable. I think the one of the memories that I don't think will actually ever make it on television, but I'll share with you, is that for the last major on-site telethon, we actually had it in the brand new education building in the School of Medicine, which has columns that are scattered. It's a round facility, and it has columns around the periphery, and there are columns that don't actually attach to the ceiling, and they're about 1.5 feet, maybe 2 feet for the ceiling. And I remember Harold Wright coming up to me and pointing to the columns and asking me if we can actually lower the ceiling so they rest on the columns. Harold, I hope you have a chance to see that piece. Right, and you're right. The footprint for children's care is large and continues to grow, and I think that's largely because it's difficult to have full children's services in a lot of communities. So we reach out and touch communities really across central Virginia. I recall a number of events in Harrisonburg associated with the Food Lion, golf tournaments, special events over there, in which I honestly and truly believe that we're as much that community's children's hospital as we are Charlottesville's children's hospital. It can be a challenge because I think folks would like to see us more often, and there are a lot of communities throughout Virginia to pay attention to. But it is a large footprint. It's not just one community. It's the whole region. The more specialized care that we provide, it's actually the whole Commonwealth of Virginia. When you think that we really, the only pediatric heart surgeon in Virginia is on our faculty, the footprint is very large indeed. Right. Over the 28 years that I've been a CEO, I've been associated with the Children's Miracle Network in 3 different locations, in Georgia and Iowa and here. The other 2 locations, they were very effective fundraisers, but they really didn't serve as a magnet to draw people together the way the Children's Miracle Network and the associated telethon and events that occur throughout the year actually have drawn people together here in Charlottesville. And clearly that's a unique element of this community and this children's hospital. I think we have been effective over the years in meeting many of the challenges that afflict children. I recall when I was 9 years old, I lost one of my good friends to leukemia. And at the time, leukemia was almost universally fatal. The survival rate now is in excess of 80%. So we've come a long way. Other diseases like cystic fibrosis and congenital heart disease, now actually those individuals are living well into adulthood. And so the specialists that we have here, the super specialists that we have here in disciplines like neurosurgery and pulmonary medicine, allow us to have a broader array of services for children than if we had a freestanding children's hospital. Our mission is not only providing the very best care, but also finding new ways of treating the ravages of disease. And so the fact that they're a part of this academic medical center allows us to push the frontiers of disease further and further back all the time by participating in clinical trials and other forms of research. But at the end of the day, the thing that's unique about caring for children is the family, the focus around the family. We're able to do it all here, not just pieces. Well, I think that it's very clear that in diseases like cystic fibrosis, it's no longer a disease that's unique to childhood. Dr. Natero indicated we have numerous individuals who are into their 40s. So the lifespan is more than doubled. Those are full-blown adults. The Free-Leaning Children's Hospital allows us to follow those individuals well into adulthood, and actually it brings the children's specialties to the adult hospital. We talk often about bringing the adult specialties to the children's hospital. Having the children's facility as part of an academic medical center allows us to bring specialties in both directions, and I think advance the overall health for children as well as adults. We're fortunate to have great leadership who are going to be a part of our healthcare future in this community, in Dr. Shannon and Miss Sutton Wallace, and I think we're fortunate to have that. And as I consider what I hope to leave those individuals and what I hope they recognize the value is of the true affection this community has for its children's hospital, it's a unique element, and I think we need to do everything we can to preserve that connection, that very, very special connection with the people who take care of children so seriously and who are so committed to this dream that we're achieving.
Not just doctors,
Yeah,
mention it
yeah,
in nurses.
right. You know, I think we've talked a lot about facilities, but a facility is just a place. Healthcare is about people taking care of people. And we have some of the most amazing staff here and physicians who are truly impassioned and dedicated to what they do. As I watch the care that goes on in places like the Pediatric Intensive Care Unit, where children are so very, very ill, and those individuals hold those young folks' lives in their hands every day. It's a real challenge, but those people truly are dedicated to what they do, and they really make miracles happen every day. I'd also say that, you know, sometimes we talk about physicians, and sometimes we talk about nurses, and sometimes we talk about respiratory therapists. But in reality, they're all part of a large team, and we couldn't provide the kind of care that we provide without not only talented individuals, but talented individuals who are working together as a true team, 24 hours a day, 7 days a week, 365 days a year. Another thing is, as I think about passing the torch, is that you just keep in mind that our focus now for sharing with the public what we do here that's unique to children starts with never-ending love. And let's make sure that our children's facility is a place of never-ending love. As we dedicate this wonderful facility, I think we all ought to keep in mind that it's really committed to the concept of healthier ever after for our children, for their families, and for the community.
Voila.